Hello, everybody, and welcome. I'm Josh from Active and Thriving, and with me is Alistair from Choosewell. We're just going to give everybody a couple more moments to jump into the session before we get underway. We do know that everybody's likely using this entering this session on their lunch break, so we appreciate your time, and we hope to add a fair bit of value. How's your day been, Alistair? Pretty flat chat?
Pretty good. Can't complain. The weather could be better. We had a great weekend. Saturday was pretty good, but back in the CBD now, and it's still pretty quiet down in St Kilda. But hopefully spring's around the corner. I'm sure a lot of Melburnians like me will look forward to that, some warm weather. So
yeah, I think people, once they roll out of bed and don't feel the need for the slippers, they'll be more inclined to walk down in the beautiful sunshine to the office.
Yeah, and we've got where the Grand Prix is behind us. Yeah, we look out onto the lake, and it's just beautiful. When the weather's good. Otherwise, we see the weather coming in over the bay, and we can catch it early, so I suppose. But yeah, we're really lucky down this end, and it's great to be back in the city. I think I know the work from home has also been great, but it's good to be out and socializing, grabbing a coffee, those type of things. So I'm not complaining.
Yeah, that's right. It's all pretty good. Okay, well, let's get started then. So another big welcome from me on behalf of Active and Thriving. So I'm Josh, I'm one of the directors, and joining me today is Alistair for Choosewell. And the session we're going through is health insurance and your budget. Now, we brought Alistair in today because a couple of clients have been using Choosewell and Compare Club to support their employees' health insurance. And it's one of those things that it is always changing. Every year, there's the likelihood that it's going to change. It might be more expensive. There might be more opportunities and more flexibility. So we thought we'd take 30 minutes a day to go into a few tips around it. And with that in mind, I'm going to hand over to Alistair.
Great. Thanks, Josh. And thanks, everyone, for your time. As Josh said, I'll keep the session to around 30 minutes. At the end, if there is some time, we can do some Q&As, some questions. Otherwise, I'll leave my details with Josh. And if anyone's got specific questions they want to ask, feel free to pop me an email and I'll see if I can answer them for you. As Josh mentioned, we are a company based in Victoria. Before we get into that, sorry, let's just start with a disclaimer. Today's presentation really is just general information. So I'm not here today to actually give you advice. As with any financial product, whether that's health insurance or anything else out there, we encourage you to reach out and chat to an actual expert or financial expert in that area. So today's presentation is really just tips on how to control your healthcare costs, your premiums with your health insurance. But if you're looking for anything specific, please make sure that you do so on a one-on-one basis with someone like us, Compare Club or Choosewell Health Inc., or another financial advisor out there. All right, with that out the way, as Josh mentioned, we are a company called Choosewell Health Inc. We also have another company called Compare Club. Really what we're about is helping people get the best value out of their health insurance, okay? You would know other competitors out there, I suppose, like iSelect or Compare the Market. Our aggregation business, which is the Compare Club side, we compete against them, and one of the areas we compete is in the health insurance side. So we help people find the best cover for their pockets, both in terms of cost and benefit. We're a group of around 350 employees based here in Victoria, Melbourne, as well as Sydney and Brisbane. Tight-knit group, and we've been growing quite a lot, so I'm sure that number will increase, but we're in all 3 states now. So we were able to help people across Australia, and our call centers are based here in Australia. So when you're speaking to someone over the phone, you're talking to someone that is based in Australia. So I thought before we jump into actually any of the tips, I'll just set the scene around what's going on. And at the moment, a lot of us will definitely have already started feeling the impact of cost of living. Whether that's your mortgage going up or your rent going up, you get that rate letter from your energy provider. Mine went up 55%, which forced me to look for something else, or just filling up your car at the local servo. So, cost of food, everything's on the up. And health insurance is no difference. And I just jumped on the ABS website and just looked up what they had around data on surveys they conducted. And in 2021 August, they came back with this slide, which I think will really change now that we're going through this inflation and all these interest rate cycles going up. But back in August 2021, a lot of people were experiencing costs according to this graph, and the average household which was spending about $108,000 per annum or $2,000 per week, we're kind of saying this is where we're spending our money. Rent or mortgage first, obviously, and food, and those are no-brainers. I think for most of us, those will be our top two. But quite interestingly, insurance is coming in fourth. And I mention that because so often we forget that all these different insurances we have, and health insurance is no different, we're not looking at them as well as we're looking at where we buy our food. For example, Aldi versus Woolies versus Coles, or just trying to save a bit on our petrol costs, using Petrol Spy or whatever app out there, and health insurance coming in fourth on that budget just talks towards household expenditure and how that is something that is high up on your expenses. So it is something that you want to be paying attention towards, especially now, I think, when we've got rate rises coming up, and you'll want to pay more attention to what's happening with any of your insurances, including health insurance. When they, in the same survey, when they spoke to Australian families or households around ranking their top 3 most stressful expenses, health insurance came in there. Around 15% of people doing the survey said health insurance was one of their top 3. Okay, so it is something that I think we keep top of our mind. We get that rate letter every year. And it's really something that I think we can have an impact on, more so than, for example, things like your council rates or things where there's not much room for negotiation. With health insurance, you've always got that option as a retail customer to go out there and find something better. So the health insurance funds, I mentioned a little bit earlier, their rate rise typically happens 1 April, and COVID's kind of changed things a bit there. And COVID's changed a lot of things, but with the health insurance funds, there was less elective surgery. So a lot of these funds were sitting on cash piles and decided to defer their increases. Bupa, HCF, Medibank, they've all announced deferred increases this year. I think it's 1 November, where we'll be seeing an increase. GMHBA, I know, is 1 October. So we're just coming close now to the next rate rise, which should have happened in April. We're now seeing it happen October, November. So you're going to want to keep an eye out for that, because I know with GMHBA and a couple of the other funds, it will be something that will be probably around the 3% mark. It's hard to say now because we don't know that number just yet, but we're anticipating around that mark. And this slide shows you what those increases have been since 2012. Now, you can see a general downward trend in terms of those headline average increases across the private health insurance market. However, what's not on this graph is wage growth, and wage growth hasn't been going up. We all be experiencing the same thing there. So there's no doubt in my mind that even though we're seeing less, or I should say lower headline increases or average increases compared to what they were 5-10 years ago, they're still going to be higher than what your wage is. So it's even more important now, I think, to make sure that you're getting the best bang for your buck and looking at that if you haven't already. So what can I do, right? I know that all these costs are going up. I know I need to look at them. Well, here's a couple tips I can give you. This might be counterintuitive to my presentation, but the first question to ask yourself is health insurance something I need? That's a personal question. I think that's something only you can answer for yourself. And really, I like to think of health insurance, especially the hospital cover, as something you should have. But we have a really good public health service here, Medicare. It is good compared to the rest of the world. There are some downs to it, and I'll list them now. But it's good to know that you still have that support in the public system. If you decided to drop your health insurance. So I'm not saying you should drop your health insurance. I'm not saying you should take it either. You really need to decide for yourself, but I just want to give you an idea of the pros and cons of each. So with Medicare, we all contribute towards Medicare in our tax, and that covers your treatment in a public hospital. But the thing with Medicare is you can't choose the who, the where, and the when. Okay, so you can't choose your doctor, you can't choose which hospital to have it in, and you can't choose when you're going to have it. You really are at the peril of their waiting list. And that can be something you're fine with, but it might be something you're not fine with. So it really depends on your needs at the time. I always say disease is a progressive thing. It's not something you want to leave too long, depending on what it is. But sometimes it's okay to have the surgery 6 months down the line. That's really something your specialist would know, but it is the risk you take when you do public. So elective surgery, there are long waits for elective surgery, especially during COVID. COVID-19 did balloon some of those waits. So just bear that in mind if Medicare is something that you're using. And as a high income earner, if a person is a high income earner, they might attract, depending on their income level, what's called a Medicare levy surcharge. So it's an additional tax that the government charges you on top of what you're already paying towards Medicare for not using the private insurance or private health market, and rather using the public market for your healthcare needs. On the other side of that, you've got private health insurance. As at June 2021, roughly 14 million Australians had some form of that cover. So whether that's combined cover, meaning private health insurance and extras, or one or the other. That number has dropped, I think, over the last 6 months. We don't have the exact data, but there has been stuff in the news, I'm sure everyone's read, where there has been some downgrades happening and some people actually making the hard choice to actually come off it. So, at the end of the day, we have to eat, we have to pay our rent, and our mortgages, those things come first. So the discretionary spend would be chopped off the budget first, and health insurance is no different to those of car insurance and all those others. So there has been a little bit of a drop, I think. And as I said, with wage growth not moving in line with some of our costs, those cost pressures are pushing down on our budgets and forcing those decisions. When you choose to take private health insurance, depending on the cover you have, let's say I take hospital cover and I choose to have certain categories covered in that hospital cover, and we'll get into that a little bit later in my slides. Then after I've served my waiting periods on those specific categories, I then have access to have those surgeries or elective surgeries done as a private patient in a private hospital according to the rules of my policy. And that's the choice that I'm paying for. So the who, the when, and the where. The other thing to bear in mind is the government does assist us with covering a portion of our private health insurance through something called the rebate, private health insurance rebate, which I've got a slide on too, so we'll chat about that. And the other thing to bear in mind is if I'm talking to someone who says, look, I'm not going to take health insurance at the moment, we're all healthy and the family doesn't need it, but I'm thinking about taking it when I turn 50. You need to bear in mind that for every year after the age of 30 that you delay purchasing hospital cover, not extras now, I'm talking hospital, there will be a 2% loading on your policy that will follow you for 10 years of having hospital cover. So you're going to want to bear that in mind. The reason for that is to prevent anti-selective behavior. In other words, someone jumping on at the age of 50, having whatever surgery they need and jumping back off, and just jump on and off when I need it. So really that's to try and protect members that are currently providing in that pool from the age of 30. The loading though is something you would need to take into consideration if you did decide to join after that. So the first tip, right? Is it for me? Is this something that I'm keen to take up and can afford, or can I not afford this right now? Should I be downgrading my cover or jumping off and understanding the risks of staying with Medicare for now, and what it means not to have cover and jumping back on later on with waiting periods, loadings, all those things. So that's the first thing. Have a think about whether or not you need it. The second tip is the rebate. So the rebate, as I mentioned earlier, is something, and I'll just jump ahead a slide quickly, is something where it's income tested based on a single or family income, where the government will pay a portion of your private health insurance usually to the insurer upfront. So as an example, I'll use myself. As a family, our income is less than 180,000 per year. Income is any income. That could be rental income, dividend income, salaried income, any income, right? So we'd sit in that first tier or base tier. And that means that we would get 24.608% as a rebate against the cost of our cover. I say it's usually included in the cost because the fund normally takes care of that for you, and they normally claim that directly with government, and you get the reduced rate when you sign up, provided, of course, that you've given them those income levels at the time. However, there are sometimes situations where a person's forgotten to do that, or for whatever reason their income's changed and they haven't notified the fund. And so they might be, let's say, on a tier 3, which according to this slide here is a 0% rebate for someone under the age of 65, but they should be claiming a 24.608. So in that example, and you'll see that blue highlighted area there, a person who's on a tier 3 that should be claiming the 24 is actually paying about $1,042 more per annum. It doesn't mean they don't get that back. They get that back in their tax, right? In their tax correction come June or August when you put it through between that time. However, for me, that's an opportunity cost. So it's not so much a saving as it is an opportunity cost. It's better for me in my budget if I can reduce that cost on my budget line now, as opposed to waiting 12 months to get that back. So I want to make sure that my policy is on the right rebate level so that A, I'm not losing any income until June, until I have to put my return in. I wouldn't say losing is the right use of words there, but basically delaying that amount to get back. Or the converse, where I might be on a tier 0 when I should be on a tier 1. And then when I land up having my tax return done, I actually have to pay money in on that tax correction. And so I'm liable for that difference. So you're going to want to get that right, because it makes sure that your budget, you're freeing up a bit of cash in that example, that 1,042 you're getting up front, which you could probably put towards something like an emergency fund or something else if you have that. So once again, not financial advice, but a tip I think to consider if you haven't looked at that. Tip 3 is choosing your excess. And these are all things I'm sure everyone knows, but a lot of people don't think about it this way. So there's 3 products there, exactly the same products, okay, but different excess levels there. For a family in Victoria, on a tier 0 under 65 with no loading, okay? The difference between a $500 excess and a $250 excess is around 8.5% or $335. Okay, now that doesn't sound like much, but if I'm talking to someone and they say, hey, I've got a corporate discount of 8%, all of a sudden that sounds great, right? Well, an excess is a way to kind of get a discount on your policy. But what you're saying to the fund is, hey guys, if I land up having a hospital event, I will cover, whether that's a day stay or an in-hospital stay, I will cover the excess according to the policy rules, of my policy. So if I'm taking a $500 excess, I'm going in overnight, I'm going to pay the first $500 up front at the hospital at the time before I have the surgery. Okay. But in return, I'm getting a lower premium point. And that's about 8.5% in this example. It goes a bit higher, around 12.9% when I am taking a higher excess like $750. We've seen in the market a lot of people hovering around the $500, not many people moving yet to the $750 because it is a bit dear. And you have to find that money before you have the surgery. But I just want to point out that if I'm not having elective surgery, and I know we all don't have crystal balls, but if I'm not planning on having surgery for the next 2.5 years, it's probably a better idea for me to look at taking a $750 excess policy and enjoy that saving. And if I'm diligent, put that difference away, so that if the excess does occur, let's say, year 2 onwards, I've got that money sitting in a bank account to use, once again, drawing from an emergency fund. If you have the ability to do that, a higher excess point means less premium for you ongoing. And it's something, a lot of us, might not be in the position to do right now because maybe, savings are a bit thin. But if you are at a point where you can do that, I'd say look at your excess and see if you can make a phone call to your fund and say, hey guys, put me on a higher excess level if you're comfortable with that. Okay. So that's tip 3, choosing your excess. Tip 4, don't over-insure yourself. So often I'll talk to someone who says to me, you know, the funds, I've got all these gaps happening, and you know, went in for surgery, and the fund really didn't support me through the whole thing, and I ended up paying all this extra money, and I've been on Gold Hospital for 15 years, and you know, you'd think that they would reward a person like me. You know, I'm going to be honest with you, insurance doesn't reward loyalty. You might get higher limits on extras and things like that, but at the end of the day, if you've been paying that primo for 15 years, you're still going to be treated in the same way as someone who's been on it for a year, because it's the fund rules. So loyalty isn't rewarded in that sense with health insurance funds, or any insurer for that matter. They might have gimmicks around, you know, you've been with us for a few years, so your limits might go up with certain extras, but end of the day, you need to make sure that you are correctly insured for what you need. Now, once again, coming back to our crystal balls, it's hard to understand that, but I think you would have a good idea of whether or not you need to have something like, you know, heart cover, you know, a heart attack cover in your premium. You know, that's in your policy. I do think we would understand in the next 5 years sort of what our risk would be, our risk appetite for certain things. You know, if I'm talking to a family that's planning on having kids, well, they're going to want to go gold because pregnancy sits in gold cover. But if they had their kids, chances are they're all pretty healthy. The kids will have things like adenoids, tonsillitis, things like that. But that's all in bronze plus type of covers. So yeah, I'd be saying to them, well, get off your gold and downgrade to a bronze and save that difference, because you'll be using it for childcare, no doubt, in the next 5 years. So, so in that example, a person on a gold premium hospital versus a bronze plus hospital, both 750 excesses, that difference is a whacking $2,200 per annum, or 93% difference. So yeah, I know that I could certainly find use for that in my budget, and I don't really want to be paying for something I'm not using. So in that example, a downgrade would work for that family. I'm not saying everyone should downgrade. I'm saying you should look at your specific situation and say, do I need these things in my policy for the next 5 years? If the answer is yes, stay where you are. Right? If the answer is no, well then, okay, I'll reassess this maybe in a couple of years' time and see if I need to add it back in. You know, it is a risk you're taking, because if you take something off and you need it, you know, then you'll have to go public. So, so yeah, once again, individual decision, but over insuring is another thing we see from time to time. A tip, I think, where you can save a bit of money. There's the clinical categories. It's a bit small, so I apologize. I will PDF this presentation for Josh if anyone wants it. But you know, the idea is government try to make things a bit easier for us on the product tiers with hospital cover, where funds now have to conform with this table. So if they have a bronze, if they've got the word bronze in their hospital cover, they'll either have basic bronze, silver, or gold. They have to, by law, then cover those blue ticks you're seeing there. Where any bronze policy would have to have like the brain and nervous system, eye, not cataracts, ear, nose, and throats, etc. So that just kind of makes it easier to compare apples with apples. So if I'm going to HCF, Medibank, and Bupa, and I'm pulling their bronze, they'll all have different names: bronze plus simple, bronze plus hospital, hospital bronze plus. It doesn't matter. I know that those categories, because it's a bronze, will definitely be in there. The plus is where they differentiate. And we'll get into that a little bit later with the slides, but I think that's quite key in that area when you're looking at cover. So tip 4, don't over-insure yourself and understand what you're buying. Tip 5, and this is coming into those categories now, reviewing your cover. It's surprising to chat to people on anything really, where they haven't actually looked at their insurances, they haven't looked at their subscriptions, they haven't looked at their mortgage. And I suppose they haven't had to with rates being so low, but now more than ever, I encourage people to look at those things, and health insurance is no different. So when rate rises happen, you should do the due diligence and have a look. You don't have to go through an aggregator like Compare Club. You can do your own research. You can jump on privatehealth.gov.au, pull the policy documents there, or go on and get some quotes on the different funds and actually compare them yourself. It's time consuming, and that, I suppose, is the downside to doing it yourself. But then, you know, the downside to using an aggregation service is they usually work with a limited number of funds. So an iSelect, Compare Club like us, or Compare the Market, they'll have the big funds. I mean, we look after funds, I suppose we've got funds where they look after about 80% of the market. So NIB, AHM, Bupa, GMHB I mentioned earlier, HCF, Australian Unity, those are some of the ones on our panel. It covers a wide share of that market, but you won't get an HBF with us, for example. So you might want to look at that one yourself then, and that's where you do your own research. But the key being that reviewing your cover is a very important thing to do. And you might not find something that's better than what you've got, right? But at least you've done that due diligence and you know that you're on the best thing. So I'd encourage everyone to do that. You don't have to do it every year. If you don't have the time, then every 2 years, but definitely make sure you look at it. Don't just leave that. I'll put up a slide here, a graph to show you 5 different funds, all with bronze plus hospital policies on a 750 excess. And you can see the spread there. The variance is quite high. You've got the highest policy coming in at 2,600 and the lowest coming in at 2,300. Now you'll notice the key word plus, right? That means they've all got bronze in there, but there are some differences on the silver category items where they cover. The other thing to remember is each fund has their own medical gap scheme arrangement, and some are better than others with different doctors. They also have their own rules about which providers and hospitals they use, and they've got rules around things like excesses for kids. So it's not as simple as just looking at a graph like this, but to give you an idea on the premium, if we look at, I'll just bring up Fund 2, $2,600. It's on a bronze category. It covers everything under the bronze level treatment, right? However, Fund 2 covers more on the silver level treatments than it would compared to the other funds. So if I'm talking to someone who needs, let's say, back, neck, and spine, but doesn't want to really go for a silver level policy, this one would be a good one to look at because it would be cheaper than the silver level equivalent, and it would have most of those categories that they require, like the back, neck, and spine. The other one, if I go back, that's just a couple slides there. The lowest being Fund 3 there, $2,300. Fund 3 is still quite a few extra conditions in there. So just by looking at what's in the market, and these are only 5 funds, they're big funds too, but just seeing what's in the market already, I can see that there's a difference there of roughly $300 per annum, which doesn't sound like much, but I don't want to be paying an extra $300 when I don't have to, right? So do your homework, make sure that you're comparing what's out there and seeing what you're paying on price point, because sometimes you'll be surprised there might be something better. The other thing, funds will provide offers from time to time. It doesn't mean that you should purchase, right? Offers are not reasons to take up health cover, but it doesn't hurt to get an offer. So, if you can get 6 weeks free or a gift card or just something for taking the purchase, then definitely make use of that because it just helps us a little bit, which is great. So from time to time, you will see offers like what I've pulled off the web here. I think this is over July. And usually around rate rise, you'll see some offers coming through from the funds too. So keep an eye out for them too. Tip 7, extras. I think extras is where a lot of us value our cover the most, which unfortunately isn't the right way to think about it. I mean, extras are important, don't get me wrong, but I think your hospital cover is more important because that's for the big stuff. But with extras, often I'll be talking to someone who hasn't used their extras, but yet they're paying a whack of cash over every year. So the first thing I'd say to you is understand the cost benefit of it. So am I using my extras to the point where it makes sense? And the simple calculation is you take the cost of extras treatment without cover. So if I never had extras cover and I just covered all the visits for the kids, myself and Liz, to the dentist and to myself to the chiro and all those things I added up on a spreadsheet versus what it would have been had I gone with a fund. Now I am with a fund, so with AHM. So I'm not endorsing AHM, just mentioning who I'm with. But there I would work out, okay, what was the premium I'm paying for those extras per month, right? So add that up over the year, as well as any gaps I had where I had to pay the provider the difference, okay? And if A is bigger than B, so if I'm paying outside of extras covered out, if I'm doing it just out of my own pocket, and that costs more than if I had it done through the fund, okay, then I'm better off having extras. Okay, so in my example, and this is actually my data, we spent about 3,900 as a family on extras, just in terms of those costs with dentists, chiro, all that stuff. Okay. And the cost of my extras per annum was 1,361. And the gap, the amount that I was paying out of my own pocket, where the fund fell short on paying the provider, came to 2,250. So in my example, it was better for me to have extras cover, because I made a savings of about $287 there in that example. So for me, it made sense to have extras. But this is something I don't think many of us do. We don't actually look at what it's costing us versus had we just done it on our own. I'm not saying you should either way. I'm saying you should just look at the number and see if it's worthwhile for you. Bit of number crunching, bit of Excel, but worth it in the long run, I think. And the other tip is using providers in the health insurer network, because with AHM, for example, if I use a Pacific dentist, they will cover my periodic exam, the removal of that calculus, the fluoride treatment, preventative dentistry, in other words, under general dentistry, they will cover that cost upfront in full for the first visit. Okay, so I didn't use that dentist because I've got my own dentist, so I prefer going to him. He's registered with a service called smile.com.au, who I'm a member of, so I got a discount with him. But I still had to pay $75 out of my own pocket. Now, had I gone to a participating dentist with AHM, I wouldn't have had to pay for that. Okay, so you will find HCF, for example, more for teeth. Bupa's also got their own providers too. So have a look at that. And I know we're all very hung up on using the same providers we've always used, and that's fine. But understand that there are opportunities, if you changed, to actually reduce your cost using providers that partner with that fund. My chiro, for example, is with AHM, and my cost has dropped from $35 out of my own pocket to around $22. So that makes a difference for me. It just helps throughout the year. Okay, so those are the tips. I think probably knew a lot of them, but it's a little bit of elbow grease to do some of those things, but it's worth doing. Even if you can just free up an extra $400 a year, that's something you could use towards your food, towards your rent. All of us I know are doing it tough at the moment, so anywhere you can save is a good thing. We have a service with Active and Thriving where we can help any individuals through that link. So if you are looking at reviewing your cover, as I mentioned, with 1 October and 1 November coming around the corner, and you want to look at that, feel free to click on that link. You'll come through to one of our agents here in Australia, and we'll help you look at your cover and see if we can find you something better. Okay. I think that's it. We've gone 3 minutes over, so luckily not too long. If there's any questions, I'm happy to answer a couple now. If you need to go, please feel free to log off. But before you go, thanks very much for your time, and I appreciate Active and Thriving. Thank you, Josh. I appreciate the opportunity to talk to your customers, and all the best with the rest of the year.
Thanks, Alistair. Well, if people want to put any questions through, you can use the chat. But I'll just like to share, I guess, my experience when I first used Choosewell, when I was working for another organization, a university. So I went through the service. It was a face-to-face in this instance, or they could do it over the phone. And they assessed my current level of cover, who I was with, and what they identified was that for that situation of my life, I was actually with the ideal cover and actually stayed with who I was, but then applied the benefit that was currently running at that point in time. So it ended up being cheaper for me, which is great. But yeah, actually due to redo this process as my life circumstances have changed quite significantly. So it makes sense to reassess it. So thanks for that information, Alistair. Really interesting. The big thing that jumped out for me was that information around how you can flex up and flex down on the excess cover and how that actually saves you money. I didn't really consider that previously. I'd always think less is best, but for me, thinking about my risk appetite, the 750 actually sounds like a more adequate approach.
Yeah, we've done that, and I think if you've got that in your emergency, your emergency fund, which I think in this day and age is quite key to have, then you've got that peace of mind knowing that you don't need to worry too much if life does, throw you a curveball, and you'll end up having some elective surgery you didn't plan, then you've got that. But having that saving, eventually that will all add up over the years, that 12% I mentioned, year on year. So, yeah.
Yeah, it all adds up. All right, Alistair, no questions have come through, so I think everybody's digesting, but we will put the information up through the Active and Thriving channels and video as well, just so you can come back to it. You can also circulate it with other people in your organization. As always, thanks for tuning in, and we hope you enjoy the rest of your afternoon.
Thanks, Josh. Thanks, everyone.